Under budgeting, Scherie has expertise across other public financial management topics, including fiscal councils, fiscal frameworks, budget oversight, budget transparency, performance budgeting, green budgeting, and spending review. She has a master's degree in applied economics and experience working in both government and parliament. Today, Scherie will discuss the macroeconomic and fiscal benefits of gender equality and the type of gender budgeting tools that can be applied to achieve greater equality, and most importantly, why childcare policies are central to this. So I'll stop sharing my screen, and Scherie, the floor is yours.
Thank you very much. I love that you have given me a doctorate, but unfortunately, I don't yet have, I'm not yet doctor status. I'll just share my screen. Coming to you from Greece today. Let me see, I'm just trying to find my PowerPoint. There it is. Good. Yeah, I'm coming to you from Greece, and I've already had to check out of my hotel. So I'm outside, hence there is maybe a little bit of wind. If there's any problem with the sound at any point in time, just let me know. So I'm here today to talk a little bit about the OECD's analysis in relation to the economic and fiscal benefits of gender equality, and how gender budgeting can be used as a tool to help realize those benefits. I guess the scene setter for all of this is really just a broad understanding that gender gaps have economic and fiscal costs. And despite long-term convergence in employment rates between men and women across the OECD, men are still more likely to be employed than women in every single OECD country. And that's despite the fact that women tend to have higher educational outcomes. Despite working less in paid employment, women work much more in unpaid employment. And on top of that, in unpaid work. And on top of that, there are tend to be in lower paid industries. And all of these factors combine to mean that essentially the population is not achieving its full potential while there's these barriers in place to participation in the labour market. Looking at the work that the OECD has done, one of the things we've done is a growth accounting exercise over the last 20 years. And it looked at economic growth in different OECD countries alongside the convergence in gender employment rates. And so to illustrate how impactful closing gender gaps can be in terms of the economy, I've chosen two cases here. One is Spain, where gender gaps were relatively large 2 years ago, but have converged significantly. And the other country is Norway, where the gender gap was already relatively low and it hasn't changed much over the last 20 years. So then if you look at our growth accounting exercise, what you see is that Spain, where there's been large convergence in gender employment, has had around 1 percentage point of its GDP every year attributed to closing those gender gaps. Whereas Norway, where there's not been much convergence for obvious reasons, has had much less GDP attributed to closing gender gaps. So you can see the potential for closing gaps to really make a strong contribution to GDP based on hard evidence from GDP growth over the last 20 years. Now projecting forward over the next, how many is that? 35 years. If we close the remaining employment gaps in OECD countries, we can see that on average, it would increase real GDP per capita by 9.2%. And so there's a lot of potential. And obviously, these economic gains are largest in the countries where the gaps are largest. And one thing to bear in mind, which is like an additional consideration, is that this is all in the context of falling working age populations, which is having real fiscal costs for countries in terms of lowering the tax take and increasing the pensions and benefits payments. And so in that context, reducing barriers to women in the workplace and barriers to earning higher pay really has the potential to also bring large fiscal gains to countries, which is incredibly important. In terms of reducing the employment gap, some of the key measures, which I think everyone is aware of, who's probably tuning into this presentation, is affordable childcare. I think in the UK context, this is particularly important. My slide here shows the cost of childcare, the average cost of childcare across OECD countries, and we can see in the UK, those costs are some of the largest of all the OECD countries as a proportion of the average wage. But it's not the only important measure. Obviously, there can be aspects of the tax and benefit system that can be inhibiting participation of second earners in the labour market. There's also the fact that women tend to earn less. It can provide less incentive to go back in the labour market, particularly if there's high childcare costs. But it's also important to recognise that it's not just about the labour market and achieving these economic and fiscal gains. You have to recognise that there's other barriers that women face to achieving their potential, and those relate to, for example, gender-based violence and gender inequality in health. So reducing gender employment gaps really requires holistic thinking about what are the barriers that women face across society and how does that impact them achieving their potential. Now, one of the main tools that the OECD sees as being able to help address these gender gaps is gender budgeting. And I don't think it's just the OECD that recognizes this, because over the last, how many years, 7 years that I've been on this file, I've seen the number of countries in the OECD practicing gender budgeting almost doubling. And I think that is because countries increasingly recognize that actually in the context of shrinking workforces, in the context of fiscal challenges and the need to improve the outlook for the economy and fiscal sustainability, closing gender gaps is one of the key areas where there's a positive story to be achieved. So how can gender budgeting help? Well, it's not about a separate budget for women's policies. What it is about is looking across the budget and seeing how does the range of budget measures impact different groups of society? How do these impact gender equality in either a positive or a negative way? And thinking about two things. One, those budget measures which have a negative impact on gender equality, how can we redesign them or change them in a way that those negative impacts can be reduced or eliminated? And two, it's about thinking about, okay, how do we create a system in the budget process whereby measures that are coming forward that are helping really move the needle in relation to closing gender gaps are actually prioritized as part of the budget process. And so you can see in this way, gender budgeting really helps improve the effectiveness of the budget, which is one of the main policy tools of the government in meeting the strategic objectives, helicopter overhead, relating to gender equality. So one of the best ways, I think, for countries and people to understand gender budgeting is to hear about it in practice. So I'm drawing on the example of Canada here. And I spoke specifically about how gender budgeting is effective because it helps prioritize key measures that are going to close gender gaps. And Canada has something called a gender results framework that it uses in gender budgeting. And when each and every new budget proposal is prepared, they have to do a gender impact assessment. And there's two things that they have to do as part of that. They have to see if it's assess if it's going to have positive or negative impacts on the population at large, what groups it's going to have positive and negative impacts for, and they have to be responsive to the results of that analysis. So this means removing the barriers that they see. So for example, a recent measure in relation to health research, they did a gender impact assessment and they realized that most of the health research that it was funding was actually looking at what were the impacts of different conditions, using trials on men, and they recognized that actually there needed to be a much more diverse approach to health research if it was going to have positive outcomes for the range of people in society. And so they introduced a new criteria that as a result of that gender impact assessment that said, okay, from now on, in order to get this health research, you have to show how you're going to take into account diversity as part of your research exercise. And then they've got a second part as part of this gender impact assessment, whereby they have to flag if one of the measures is going to move the needle in relation to one of the key areas in their gender results framework. And so this is a way of signaling to the political, the political decision makers that these are measures that are going to be really important if they want to have a budget that's going to be effective in closing gender gaps. And what happens is all the budget measures coming in, which are flagged as potential for moving the needle in relation to these key gender gaps, then go into a placemat, which is analysed by the Department of Finance, as well as the Minister of Finance, as well as the Prime Minister during the budget process. And they use this mapping in the placemat to see, do we have adequate measures coming forward in the budget that are going to help address these gender gaps? And they've used it as a tool for communicating back with the departments and saying, look, it's great that we've got measures coming forward in relation to the pay gap, but we've still not got enough coming through in relation to closing the employment gap. What can you come forward with? And in this way, it incentivizes the departments to prepare budget measures that are going to help close gender gaps, because they know that that's what the Minister of Finance and the Prime Minister are looking to when they're looking to fund new measures as part of the budget. And so Canada, as a result of this, in recent years, has taken forward a brand new policy in relation to affordable childcare, where they're reducing the cost of childcare across every province to just $10 a day, I think by 2025. And so that hopefully you can see from this what the concrete outcomes are from a tool such as gender budgeting in relation to closing gender gaps. Another example briefly comes from Iceland, where, for example, the government was doing a tax reform, and when they were doing a gender impact assessment as part of gender budgeting of this tax reform, they realized that there was a credit that was inhibiting the participation of second earners in the labour market, because it was a credit that could essentially be used by the higher earner if it was not used by the secondary person in the household. And as a result of that, the gap in earnings between the higher earner and the lower earner widened, which made the hurdle for entering the labour market much higher. And so, as part of this impact assessment, the government proposed to change the design of the income tax reforms to remove this second earner tax credit and remove this barrier to their overarching goals of reducing the pay gap and reducing the employment gaps in Iceland. Unfortunately, this story didn't end well, because Iceland actually still got so much pushback from Parliament in relation to removing this tax credit that they didn't remove it in the end, but it's something that they did with their eyes open, and it's something that highlights, I think, importantly, that the difficulty in still persuading the gatekeepers, who are largely men, about the benefits to society at large from reducing gender gaps. So there are some examples from the OECD. I hope that's been helpful, and looking forward to the other presentations, and welcome your questions afterwards.
Thank you very much, Scherie, for your presentation. I made some notes about the fiscal cost of not closing the gender gap, the price of childcare in the UK, which I'm sure everyone will be thinking of. You mentioning the importance of carrying out impact assessments of budgets, something that we also advocate for, and the price of childcare in Canada. So the aim is for families to pay $10 a day. That's significantly lower than the £80 per day that most people pay here. There is a question for you already in the chat, so I'm just going to acknowledge the question, but we will pick up at the end during the Q&A, if that's okay. So I'll now introduce our second speaker, Dr. Peter Huber. He's a senior researcher at the Austrian Institute of Economic Research, with 30 years of experience in policy-oriented research. He has worked at the Austrian Institute of Economic Research since 1998 and served as a vice director for external coordination between 2012 and 2014. During his career, next to teaching at Austrian universities, he studied, taught and researched in Brno, Berlin, Olomouc, Almaty, and at the University of Illinois. From 2010 to 2019, he was also a lecturer at the Mendel University in Brno and is an elected member of the Committee of Regional Theory and Policy of the Verein für Sozialpolitik. I'm not sure I pronounced that well. His main research interests are in labor economics and migration, which is also a topic he has widely published on in journals such as the European Economic Review, Regional Studies, or the Journal of Regional Science. Peter will share key insights about Vienna's experience of investing in childcare, and we look forward to hearing all about it. Peter, whenever you're ready.
Yeah, thank you. Let me just get the screen set up. Thank you for the wonderful, very kind introduction, and thank you also for inviting me to present some results of a study we did relating to gender budgeting in Vienna a few years ago. I thought that in my presentation, well, I'll present you the study and some of the results, focusing on the kindergarten issue. Before that, I'll quickly give you some background to the city of Vienna and some background to the study and its motivation. So I do this when I work in Vienna because I'm always concerned that the specifics of a place make make a difference in terms of why certain policies are put in place and why certain policies work in one context and maybe don't work in another context. So in Vienna, if I were to describe Vienna, I would say it's a young, growing, and very diverse city. Yeah, so it's the youngest of all the federal states of Austria in terms of demography. It has, I think, the third largest share of foreign-born among the EU metropolitan regions. So I think only London and Paris are above Vienna in that respect. It is also a city that has a long tradition of focusing on gender equality, or better said, on equality in general. So there is a I'm not sure if you're aware of the Red Vienna at the turn of the 20th century, and I think ever since then the government in Vienna has been social democrat and focused extremely on equality issues. But it also outperforms most of the rest of Austria in terms of indicators of gender inequality. But the city also has had typical metropolitan problems. There is a rising income inequality. There's a low employment rate in relative to the Austrian average overall. And particularly relevant for the context of our study, there at the time when, so in 2009, when this was introduced, there were serious issues with the provision of childcare facilities. So just to talk from my own experience at that time, I'm not sure it has fully been resolved, but at that time, even colleagues working at my institute who are by no means underprivileged and who are also very able to afford childcare and finance it privately, they still faced problems finding childcare. And we had repeatedly over and over again people who came back from maternity leave, wanted to come back and said, look, I found no one to care for. I have to add another year to my maternity leave. So that was a real problem. The background to the study is more in the direction of the gender budgeting initiatives that have been around in Vienna since 2005. So the city council decided in 2005 to implement gender budgeting, and the way it was implemented is very similar to the examples that have already been given. So there is an iterative process where a department of the city is responsible for collecting the budget plans and receiving from the various sub-departments a statement as to what are the flagship initiatives with expected impact on gender equality. And then in an iterative process, it is discussed whether certain measures should be expanded, reduced, and how the budget is going to be put together. Since 2013, there's a periodic equality report, so which looks at many more dimensions of inequality, but sort of every 3 to 5 years, the city writes a big report trying to establish issues with inequality in the city. Now, the study was done to evaluate this gender budgeting process, and in the course of our discussions, the city also said that at times they do not have a real picture of whether, they assume certain things about the effectivity of certain measures, but they are not sure whether these in the end work out the way they expect them to work out, and that they would also be interested in a number of smaller evaluations of individual measures, headline measures that they have conducted in Vienna, and the kindergarten is one of the measures. So we sort of did we looked at the process of gender budgeting, and I'm not going to talk about much about that, but we found that a lot of these measures are also related to simply building awareness in many respects. That childcare is obviously one of the areas where a lot is going into, and so we decided that in looking at the individual measures, we decided to look at three things. The one was the kindergarten. Another one was a program initiated by the city that if you apply to research grants with the Universities of Applied Sciences, which are under the Viennese budget, so the city of Vienna has a lot of influence on them, you have to also submit a gender equality plan. And we also looked at what some of the public transport investments meant in terms of gender equality. And on the right-hand side, you see a little bit the enrollment rates or the percentage point changes in enrollment rates of females in certain degrees after initiating this this gender report or the equality plans in 2006. And I find it very interesting because it's a measure that actually doesn't cost much. All it does, it sort of puts an additional requirement on providing funding. And we do see that in particular in those disciplines like natural sciences, where females have not been very not many females came into these studies. We do see an increase in the participation. We also looked at the building of a metro line in a socially deprived area. There actually we expected that women could profit disproportionately from such public infrastructure, simply because in many households we know that women are sort of the second earner, and if you use the car, it's usually the man that gets the car to drive to work, and then the woman is remoter from that. That didn't turn out. We found that it does reduce the female unemployment rate, but the effects are similar on men and women, and that may just be because we're looking at a really deprived area there, and it may be that this car story, due to the lack of cars among the residents, wasn't so important. So this brings me to the kindergarten, where we did a little bit more work. And as I said, before introducing the free kindergarten in 2009, the situation in Vienna was marked by a severe scarcity about childcare places. And the second component into the political debate was also the increasing social and ethnic divides that were showing in the city, where one of the lines of discussion was that often children from poorer households, also from households with a migration background, come to primary school with very low knowledge of even the language. And so one hope was that by introducing a kindergarten and by bringing more children into early childhood education, the general educational attainment already in these very young cohorts would be improved. And so on September, the city council reformed the financial support system to the childcare facilities, and sort of did a support that was depended on the age of the child and ranged from 60 to 240 euros per child per month. There was a support for each group, and then the problem in Vienna is always it's a city, so many people are commuting in, and the city had the problem that they did not want to fund too many of the people who were residents of the neighboring federal states. So there was an additional bonus for children with main residents. And now on the right-hand side of the graph, you see how the budget develops. 2009 is the year where the program kicks in 2010. And you see that the program was sizable. So going away from the 2008 figures, it's about 250 million until the end of the period that childcare costs, budgetary childcare costs for the city of Vienna increased in that time period. So you can see that as a large thing, but the 250 million should also be seen in perspective to the GDP. So it's about 0.3% of the Viennese GDP that was invested in the long term in that. Yeah? The one exception, which also caused some debate in the later implementation of the policy, was that what wasn't covered were costs for meals and costs for excursions and extracurricular activities that the kindergarten provider was willing to organize. And this is all subsidies, of course, to private kindergartens. So the idea was we will found new private kindergartens through that, and not. There is also a system of city-owned kindergartens in Vienna, and not an investment into the city-owned kindergartens. So this just shows you what happened on these in response to that. The number of establishments rose dramatically and very rapidly. So by 2009, a lot of kindergartens were founded. Many of these groups were admittedly small, but you also see that bringing the children into the kindergarten system took some time longer. The other lines are just the other provinces who did not introduce a policy like that, just to make you sure this is not something that happened in all of Austria, but that is something that is due to the policy being initiated. And as I said, you see clear in the number of establishments. So we were interested in two things. First of all, did this increase the labor supply of women? And we focused on those females that are aged between 20 and 29. And we always compared the female participation rate in Vienna pre-reform to the other provinces of Austria that did not introduce this, and then looked at the post-reform development. And we look at two things. We look at the extensive margin, so the decision whether women of that age group are working or are not working. And we also look at the extensive margin, because we expected that part of the policy result was that women who were already working part-time, there's a 45% part-time employment rate among women in general in Vienna, so it's a very high one, would work longer hours. So that would be one of the additional effects. And you see that we get, in that group, we get about 1,000 full-time equivalents that come out of so the larger effect is actually the working time effect and the number of women that enter the labor market. We find an increase in the participation rate in that group by 1.5 percentage points, increase in employment rate of 1.2 percentage points, and about 0.7 hours work per woman in that time. Interesting side effect. We also looked at overqualification, and the motivation there was that perhaps women who are working longer hours will also look for more for jobs that are better suited towards their skills. And we also find that this overqualification has reduced significantly. High effects are among single mothers. So the effects are even higher among single mothers, and substantially larger, or not moderately larger, with women with children under 3. That was one thing. So yes, we find very positive effects actually on the group of childbearing women or women in the childbearing ages. The next thing we did is we then looked at the macroeconomic effects of this expenditure, and on one side we just fixed on the effects of the increased expenditure and of the labor supply. And you see, and these are effects on employment, and these are effects on GVA. And you see that on the one hand, the effects of the direct expenditures for the kindergarten in terms of both employment effects and expenditure effects dominate very strongly the effects of the increased labor supply. On the other hand, because Vienna is an open city, there are also spillovers to other regions, and actually the region of Lower Austria, which surrounds Vienna, is one of the big profiters too. So basically all this difference in the Austrian bar, in the orange bar you see, are going to one other federal state of Austria. Before I come to limitations, as a response to sending the presentation, I was asked what the budgetary costs or returns of this income are. Those were not very much in the center of the study at that time, because the Austrian system of transfers within the state implies that all of the revenues accrues to the central state, and that actually the regional government only profits marginally from any changes in the financial situation. But we checked on that, and we get, of the 360 million expenditure we simulated, we get returns from both taxes and social security subsidies in the realms of 300 to 320 million. So basically 80% definitely self-financing if you consider the state to be a unity. If, like in Austria, you have a federal system, Vienna only gets 20 million of all these revenues. So from a financial point of view, for the city of Vienna, directly, it was not a self-carrying program. Tell you a few things that have been written since, and the things we don't have. One of the key issues we are looking at, because that was one of the key measures for the reform, is to improve educational outcomes, especially among poorer groups and deprived groups in the population. And it's just too early to say, because until these kids that are now in kindergarten, probably now they are somewhere about to go to the upper secondary school, and before they come on the labor market and finish their educational careers, we still have to wait a little bit. There was another study done by colleagues of mine in Linz, who looked at the distribution of the newly founded kindergartens, and they slightly criticized the program, because this move from city-provided kindergartens to non-profit private enterprises, according to them, shifted these non-profit organizations had a tendency to go to areas that were economically a little bit better prepared or better placed than the state-owned kindergartens would go, which go into the really deprived areas. And so they say it increased, or they find that this measure increased the inequality in the provision of childcare. There was some critique, which never, I don't know whether it has ever been looked at in a scientific way, but it went through the media, and it is a favorite complaint of many parents that say that, of course, the childcare providers overcharge on that part of the activities that are still self-financed, which basically means meals and extracurricular activities, and that has sort of shifted the burden a little bit into these things. And there was also one of the concerns, and that did arise, is this massive increase in the number of childcare provision facilities also led to the fact that in 2008-9 and in the early years, the city did not have enough resources to really control all these kindergartens and the pedagogical concepts behind it. And there were reported instances of not in mass, but individual concepts where very dubious pedagogical concepts were done, or where the founding of the facility was like openly done with fraudulent intentions. So that may be another thing to keep in mind when embarking onto an expansion of the childcare aspect. So that's all I have to say, and I thank you for your attention, and I'm looking forward to any questions you may have. Thank you.
Thank you very much, Peter. That was very, very interesting. And talking about questions, there's already one in the chat that we will again discuss during the Q&A.
Let me just ask, do you have the screen back? I'm panicking here.
No, it's all good. You're not sharing anymore, so it's all good. Thank you also for looking at that kind of like return doing that exercise. I know that it was complicated due to the way budgets are set in Vienna and the transfers from the states. Good to know that this investment had an impact on single mothers, because we know that single mothers are more likely to experience poverty, and that it also had an effect on women that were able to use their qualifications and to access better employment, because that also came up in our survey, women having to work in other sectors to be able to manage childcare responsibilities. So I look forward to the Q&A, but in the meantime, I'm just going to introduce our third and last speaker, Jonathan Broadberry, Director of Policy and Communications for National Day Nurseries Association. Jonathan is responsible for NDNA's policy and press work within England, Scotland, and Wales. He works with NDNA members and strategic government contacts, policy advisors, and the media to promote policies which support quality early years education and care. With a background in national and local government, he has experience in delivering real change through lobbying, engagement, and media work. His role is responsible for supporting the organization's national policy committees, as well as managing the work of NDNA Scotland and Wales. Jonathan will focus on why investment in early years leads to better outcomes for children and society. So, Jonathan, whenever you are ready.
Unmute. I'm unmuting myself there. I'm hoping you can see the presentation and not the full double screen. So I'll just make that full screen. So I'm hoping that that's coming across fine.
No, we see the two.
No. All right. Okay. Sorry about this. Sharing. So are you just seeing the one screen this time?
Yeah.
Lovely. Perfect. Right. Well, thank you very much for having me along today. I do want to bring this back to the kind of UK and the Scotland context a little bit more, but also looking longer term in terms of what investing in early education and childcare can do when it comes to tackling the the question of poverty, as well as that immediate financial benefit that the other speakers have addressed. And I'm following on with Scherie. I'm always a little bit nervous about presenting other people's data back to them, but I'm starting with the point, and it might seem like a daft question, but is childcare expensive? And as Scherie presented earlier, in the UK, traditionally, we have seen that it is very expensive, and that it's a key element in families' expenditure, and that impacts people's decision making about returning to work and decision making about the type of work that they return to. Well, one thing that I just want to address a few points around the OECD data. So obviously it is a UK-wide picture, and we have certainly in the last 4 to 5 years seen diverging policy approaches across England, Scotland, Wales and Northern Ireland. It also reflects costs as a proportion of average earnings. So, in other countries, earnings elements might be different, and that means that the comparisons are very important, and a lot of comparisons are with Scandinavian countries, and I think one of the important points that Peter raised is applying this element in a place context. So we're not in the place that you would see in Scandinavian countries, but when we compare with some of our more local comparators, say France and Germany, we're still a long way behind where we'd want to be on affordability. The other key point for the UK context is that it assumes families have 2 children, one who is aged 2 and the other who is aged 3. And why that is so important to those statistics that I just shared is that historically the UK funding has been aimed at 3 and 4 year olds, and we see that at the moment in Scotland. The 1140 hours is universal for 3 and 4 year old places, whereas when it comes to support for 2 year olds, it is more income-based, targeted, and so there are fewer eligible children who are getting that support. So it is a period where delivery of childcare is more expensive when you look at the number of staff needed, the amount of space needed, and the extra resources like consumables that children who are younger need. At the same time, it is an area where traditionally less investment has been put into by governments. And one thing to note, so the OECD data that I presented before is suggesting that around 25% of household income is on childcare across the UK. Now, for context, the Office for National Statistics in Scotland says that around 17.3% of the average weekly expenditure is on rent, where people are renting, and for home owners, it's 12.2% for the mortgage. So for a lot of people, when they've got those younger children in that 0 to 5 bracket, the costs can be higher than rent, can be higher than mortgage when they're looking at it. Just quickly to touch on what does that mean in real cash terms. So we've talked about percentage of earnings. Quorum's survey of childcare costs showed that in Scotland, the average cost for a 25-hour nursery place is a little bit lower than other parts of the UK, but the rising costs is still seen and still felt by families, and actually it's more accentuated in the 2-year-old places even than the under 2s. So this brings us back to the question of who is it who actually pays for those early learning and childcare places, and this is almost the counterpoint to that first graph from the OECD. Again, this is OECD data This is updated up until 2019, so there has been further expansions in Scotland since then, but again, less so in the 2-year-old space. So it still will be an issue. And what we're seeing here is actually equalized across currencies. Whereabouts do governments sit in terms of the amount per child that they pay in those two brackets, the 0 to 2 bracket, where the OECD classifies childcare, and the 3 to 5 where they consider pre-primary. And again, the UK is about 2/3 of the way along that continuum, towards the lower end. But the interesting comparison is those countries around us, where it's Estonia, Slovenia, Hungary, Latvia. So countries where whilst that's the real cost that they're putting into investing in their children, the actual costs of delivery are higher in the UK than in those countries. And that's pulled out in this very rough analysis here. But when you overlay the cost to families against the amount of spend per child, you can see that in the right-hand side of the graph, when you're looking at Germany, France, Sweden, and Norway, the corresponding increase in levels of investment from government sees a reduction in the price that the cost that families pay. And the standout in that graph are UK and New Zealand, where a relatively low level of investment from government leads quite clearly to a higher proportion of income being spent by parents on those childcare places. So it's just that, putting it into context, that it's not just about how expensive is it to parents, but also where does that investment come from? Are we asking parents to pay, or are governments putting in that investment for the good? As I say, there's been some changes since this data was published and collated, but at the same time, because there's not been the same expansion in the funding for 2-year-old places in Scotland that there has been for the 3 and 5s, there are still parents facing those higher costs because of how that data is collected. So what is the case for investment? And I'm going to talk more about the long-term benefits. So the other speakers have talked quite a bit about the immediate economic impact, and obviously it's very important for working families and for children in those families that access to funded childcare can help people work, and not only can they work more, but at the same time they can do things like increase their hours, or as Peter pointed out, actually reduce some of that overqualification. So somebody who is a professional accountant, instead of returning to the workforce part-time and working in leisure or retail because the hours suit them more, if there is more access to funded childcare, then they are more likely to be able to return to a job at a qualified level that they were working to beforehand. So that's a really important point. The other thing that I will just mention on that as well, in terms of well-being, is if you have parents returning to work just for their existence, and they're maybe not feeling as satisfied in their role as they were previously, that clearly has a compounding impact on children as well. So so picking up on why investment is crucial in this period of a child's life, for the longer term, and John Swinney as First Minister has committed to addressing child poverty, eliminating child poverty long term, is that actually it's a crucial stage of their learning, their development, which we know has knock-on effect on later educational outcomes and attainment, life chances, and therefore the longer term benefits for children and the society are what I want to kind of focus on a little bit more. So evidence shows that access to high quality, and picking up on Peter's point, it's the quality that really counts. There's a long-running study in England called the EPSI study, which tracks cohorts of children over an extended period of time. And what that found was that it's not just is that child accessing formal early education and care, but actually what the quality of it is. Because if they are at home with parents and families, then you can see the same level of progress and development as if they are in formal childcare settings which aren't of high enough quality. So it is really important that that quality aspect is there. But it's especially the children from the most disadvantaged backgrounds who have the most to gain from that high quality early education and care. Just to highlight, in Scotland, there has been improvements over the last, I think, 10 years in terms of the attainment gap. COVID obviously has had a knock-on effect, but there is still a persistent gap in literacy and numeracy when children at primary school between those who are the most disadvantaged and those who are the least. And evidence by the Education Policy Institute suggests that around 40% of the disadvantage gap that exists at 16 is evident by the time a child is 5. So, it's a crucial stage of their development. If they're invested in properly and accessing high quality, then they can come along in leaps and bounds, and that can close the attainment gap very, very effectively. If we don't invest in those children, then that attainment gap grows, it becomes established, and it's harder and harder later in life to address that. And finally, some research by the London School of Economics found that the cost to the economy in England is £16 million every year. In the later, sorry, excuse me, just one moment. Then later interventions, and that is looking at things like prisons, later interventions with special educational needs, social care that are higher later in life, where the investment is insufficient in those children's early years development. And that's very well illustrated by research done by Professor James Heckman in the United States, and he's converted this into a visual representation. So when we look at how much government spend on education in primary, secondary, and then on to higher education and further education, what we see is probably an inverse of this graph, in that the least amount is spent on children's development and education in the early childhood and preschool stage, followed by growing levels of investment at that later level. But what that does is it is less impactful. So if we get it right in the early years, then all of that spending later in life has more of an impact. If we don't get it right in early years, then it's too late, and it takes a lot more work to close the gap later in life. So that is the real case for better investment in early childhood learning and education, because it makes the difference later in life, where everything else can build on. And we talk about being a foundational stage for children, and without those strong foundations, then everything else is less impactful. And in one analysis, Professor Heckman estimated that return on investment was between 7 to 10% on one preschool intervention. So it comes back to that point that the LSE found, that it's when we're intervening with crime, social care, all the problems that become established later in life, that's where governments end up paying out a lot more on on a failure to get things right in those early years. Just one example from NDNA and our own work. So we've got a program that targets maths in early years. It's been identified as a gap throughout the throughout the education system, and what we found with that was with targeted support to the professionals working with those children, within the space of 9 months, children on the Math Champions program were able to make an additional 3 months progress, and this was against a control group not in the program. And although the sample size was too small to say this with any confidence, the suggestion from the data was that for those children who were on the early years pupil premium, which is the kind of like free school meals in at school age, they made additional progress on top of those 3 months. So again, it goes back to that evidence that says that children from disadvantaged backgrounds have the most to gain from access to high quality. And this is not an expensive, this is not talking about, spending hundreds of millions. Some of these interventions can be low cost, but really high impact. And that's what the evaluation of this program found, that the impact was due to the intervention and the cost was relatively low. I just want to finish on what happens when we don't get it right. So we survey providers in Scotland, and they look at the funding that they get and how they are able to deliver high quality childcare, early learning and childcare with that. 70% say that the funding that they get doesn't cover their costs, and as a result, the similar proportion say that they're looking at operating at a loss or just break even. And that's really important, because if a setting is operating at a loss or doesn't have additional surplus, that's no opportunities to invest in staff development, which are absolutely crucial to children's outcomes. No investment in improving spaces, in resources, because the funding is there to pay for the place, it's there to pay for the meal, but everything else has to come from what a setting can bring in. There's a problem around additional support needs, and the funding that's available to help with that. And again, we come back to additional needs for children. So if we get the investment right in the early years, it can lead to better outcomes later in life, and less need for more expensive interventions later in life. We've got a high workforce turnover, and again, that is a financial burden for employers, but also crucially for children, it's disrupting the continuity of care. Again, at that critical stage where they're forming emotional bonds, they're forming trusting relationships. What we want to see is people who are committed to working in the sector and being able to be paid and recognised at a level that keeps them within the sector. And finally, whilst parent satisfaction with funded childcare policies is high, and uptake is high, there is an interesting aspect to the data, which is that 73% of parents use the full entitlement. So if they're entitled to 1140 hours, a proportion are not getting the most out of that entitlement. And the main challenge for those parents is flexibility and availability of places that suit them. What we've seen that some settings are forced to close, that some settings can't open at all the hours that parents need. So there are elements of making sure that this works, because again, if we're going to realize the benefit of parents going back to work, it has to work for them. And just a final thought. So we've heard from Scherie about gender impacts assessments and looking at the impact of policy decisions on women. A key thing that's changing in Scotland this year is actually the implementation of the UNCRC into Scots law, so taking it from international treaty status to actual, rights and responsibilities for Scottish children and on Scottish bodies and authorities. And one of the things that will come out of that is the need to do child rights and well-being impact assessments on decisions making. So it will be really interesting to see how that translates into, as Scherie said, when gender-based assessments are done, it changes how policymakers make decisions. We want to see this translate into children, because at the end of the day, the policy has to have children at its heart. It has to benefit children. So this could, potentially really revolutionize this whole debate. So that's everything that I wanted to share with you. I will just stop sharing my screen.
Yeah, thank you. Thank you so much, Jonathan, for your presentation stats that you brought up. And I have a few notes as well here, and there are a few comments as well on the chat. So we'll go into the Q&A now, but I'm just gonna start from the very beginning. So the first question that we got was for Scherie. So in relation to Scherie's presentation, this obviously related solely to a GDP-only focused understanding of economy in which unpaid care is not counted. Can you share anything on how closing gender gap relates to wider metrics significant in a well-being economy framing?